girl.
He's so pretty.
She loves her babies. We love her.
Is she going to the shelter after this?
I'm going to take her back
Okay.
until Thursday, and then
Perfect.
if she's recovered enough by then she'll go for adoption with Zoe.
Good. I was thinking that was a good idea because she will have sutures where that tooth is, and I'd like her to have soft food, and that will just give it a few days, and then we won't have to worry about other owners taking her and saying you have to give soft food for. Not that she's gonna use her canine too much, but then can peek at that tooth and. It's 160. She's a nice girl. Her lungs are good. Can I feel your tummy, sweetie pie?
Oh, she's doing very well.
She is.
So this is part of the pre-op exam.
Yeah, we give them a full exam before. I mean, she's been examined quite a few times recently, but it's just nice to make sure nothing's changed and their heart's okay, lungs are okay, abdomen's okay, no surprises. Temperature, good catch. She goes, I have to go now.
So I heard Denise doing that.
No, she goes, I saw that for my kids
I remember
the other
that
day.
from last time.
Denise is a cat whisperer.
That comes in handy probably.
Yes.
Wow, that was pretty expertly done. Aww. She's a big girl.
She knows lots of cat handling tricks so that the cats are as calm as they can be.
Yeah, that was pretty. She's pretty relaxed considering.
Mm-hmm.
And then what we'll do is we're going to drop some medication and give her what's called a pre-medication. And the pre-medication will have some sedation in it. And we'll also have some preoperative pain medication.
Oh.
So by the time she goes to surgery, the pain medication's already on board. So
Great.
So her temperature is fine, as we expected. 100.1. We're holding her and I'll grab her meds.
Yep. Look how happy she is. She's so sweet, such a sweet cat. Close up of a cat face.
Says I'm ready to go.
And now, time to explore.
This is a new place.
Maybe we'll go IM? Yeah. So what I'm going to give her is something called hydromorphone. It's a cousin of morphine.
Oh.
And it's a very strong pain medication.
Okay, Firefly. It's just a little sting. Yeah.
And it has also...
That was a mean bite. Sorry.
Oh.
Sorry.
We poked you in the bum, didn't we?
I did. And it has a little bit of something called acepromazine, which is a little bit of a tranquilizer, just to take off any anxiety she has.
Look, you blend into my shirt.
Oh, what a good girl. What a good girl.
Should we let you chill in your kennel?
Yeah, we have a little place set up for you. She doesn't have a big bladder. She must have peed already this morning, but we can leave it in there for a bit.
Okay. You ready?
Oh. I have blankets that smell like her kittens, unless you guys use special sterile ones.
Not in their kennels.
No.
So.
In surgery, but
Yeah.
you know, things like that.
So I'm just gonna set her in her kennel just to, so that.
Do you want me to help you?
And
Okay, it's time for Firefly's catheter.
Come here, sweetie.
Oh,
groggy girl.
She's like a groggy kitty.
She's feeling good. Feeling relaxed. magnificent specimen. So if anyone is squeamish with needles or anything like that, or you may want to avert your eyes. Oh, lots of kisses.
Is this charged already?
Yeah.
Yeah, thank you.
And I did plant it, so
Thank
you
you.
can get it. So when you do go to flush it, flush from
Yeah,
there
okay.
or
Do we have flush?
Yep. And I got your extra long piece of skinny tape.
Thank you.
We're getting there.
We're getting to know each other better. So we put in an intravenous catheter because for a couple of reasons. One is she's not going to be drinking very much today, so it's just a way of giving her more fluids. The other is if we need to give her any medication while she's sleeping, we have a vein that's already open and we can just give medications. And then also, if her blood pressure isn't exactly where we want it while she's sleeping, it allows us to adjust her fluids. And we can make sure that we have her blood pressure exactly where, or hopefully exactly where we want it. So it's a safety precaution, and it's also a nice thing to not be dehydrated, because I'm just gonna make a noise, Firefly. You good with the noise?
Okay, sweetie.
Oh, getting a little haircut.
Yeah, it just allows us to put it in more sterilely.
That wasn't so scary.
No, life is better when you're relaxed. That's the thing about these days, is we have such good pharmacology that there's really no need for animals possible to be very stressed or at all painful. You can just make the experience very relaxing or as less traumatizing as possible.
That's great. I'm sure that's very comforting to lots of people watching. It's kind of a black box when you drop your cat off at the vet. You don't really know what's happening.
One day, hopefully in the near future, my plan is to actually, this is good, I wanted to put a little video out about some of the mysteries about what actually goes on, because like why do we recommend a catheter, and some hospitals don't recommend a catheter but some do, and there's good reasons for doing it. Often to the client there's a teeny bit more of an extra cost because it takes more time and supplies, but it's a nice safety precaution.
Yeah, it sounds like it's worth it.
I don't like to be dehydrated, and I don't want my patients to be dehydrated. So,
Oh, she didn't even flinch.
no.
She's feeling good.
Yes.
So that one was not like the other one.
No, one in the muscle, when we're not warning, it was a little bit unfair. So we are just taping in this catheter so that when she moves it doesn't come out. Because she's still very much awake, she's just a little bit sedate. And if you also, with the pre-medication that you give beforehand, it allows you to use less anesthetic drugs, which is safer for the patient.
Mm.
You don't have to have them on as much gas. You don't have to. It's safer to use a smaller amount of many medications than a big dose of one, because all medications have side effects. So you avoid the side effects if you have a nice combination of smaller amounts of medication.
That makes sense.
Let everybody see that you're wide awake.
Do you want me to just tape it like that?
Yeah, or sometimes that's where I put the little bit of vet wrap on. But I like to have that taped up so that it's not flopping around. That's what scares them sometimes.
Oh, pink. That's nice.
Perfect color for you.
She looks good in pink.
It's very
She has the color gray that would look good in anything, I think.
Yeah, pink, purple,
Yeah.
green goes with her eyes.
Yeah.
I'm just gonna give it a little flush, just to double check that it's in, but. So this is just saline. It just tells me that, and it flushed easily, that my catheter is in. So when we need it,
There.
it's there.
Great.
Good girl.
Oh, she's relaxed.
That's what we like.
Good girl.
Oh,
That wasn't so bad, was it?
what a
Okay,
special
sweetheart.
kitty.
Okay.
All right, back into her
Back
little
into your little relaxing place.
She gets
Get a
to
little
stay there
soft.
for probably at least another